Cariprazine is an antipsychotic. It is used to treat schizophrenia or bipolar disorder. Bipolar disorder is also known as manic-depression. This medicine may be used for other purposes. Ask your healthcare provider or pharmacist if you have questions. How to use? Take this medicine by mouth with a glass of water. Follow the directions on the prescription label. You may take it with or without food. Take your medicine at regular intervals. Do not take it more often than directed. Do not stop taking except on a doctor's advice. For bipolar disorder and manic episodes related with schizophrenia, adults at first 1.5 mg once a day. Your doctor will adjust your dose as needed and tolerate it. However, the dose is usually not more than 6 mg per day. Children, use and dose must be determined by a doctor. For depressive episodes related with schizophrenia, adults at first 1.5 mg once a day. Your doctor will adjust your dose as needed and tolerate it. However, the dose is usually not more than 300 mg per day. Children, use and dose must be determined by a doctor. Who should not take cariprazine? The following conditions are contraindicated with this drug. Check with your physician if you have any of the following. Conditions: excessive fat in the blood, dehydration, overweight, low levels of white blood cells, low levels of a type of white blood cell called neutrophils, suicidal thoughts, a type of movement disorder called Parkinsonism, tardive dyskinesia, a disorder characterized by involuntary movements of the face, mouth, and tongue, extrapyramidal disease, a type of movement disorder, neuroleptic malignant syndrome, a reaction characterized by fever, muscle rigidity and confusion, a low seizure threshold, a heart attack, chronic heart failure, orthostatic hypotension, a form of low blood pressure, seizures, weight gain, difficulty swallowing, high blood sugar, susceptible to breathing fluid into lungs, pregnancy, dementia in an elderly person. Precautions. Before taking cariprazine, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Older adults may be more sensitive to the side effects of this drug, especially seizures, drowsiness, dizziness, lightheadedness, confusion, tardive dyskinesia, swallowing problems, and other serious or really fatal side effects. Side effects. Side effects that you should report to a doctor or healthcare professional as soon as possible. Allergic reactions like skin rash, itching or hives, swelling of the face, lips or tongue. Breathing problems, confusion, fever or chills, sore throat, inability to keep still. Problems with balance, talking, walking. Redness, blistering, peeling or loosening of the skin, including inside the mouth. Seizures, signs and symptoms of high blood sugar such as being more thirsty and hungry or having to urinate more than normal. You may also feel very tired or have blurry vision. Signs and symptoms of low blood pressure like dizziness, feeling faint or lightheaded, false, unusually weak or tired. Signs and symptoms of neuroleptic malignant syndrome such as confusion, fast or irregular heartbeat, high fever, increased sweating, stiff muscles, sudden numbness or weakness of the face, arm or leg. Suicidal thoughts or other mood changes, trouble swallowing, uncontrollable movements of the arms, face, head, mouth, neck, or upper body,